We may not have a lot of coronavirus testing in this country, but we do have a lot of people all over the country who are realizing that they have fevers. Fever is one of the most consistent symptoms for the onset of coronavirus. There's a company called Kinsa Health, K-I-N-S-A, that makes thermometers. And what makes the company different and what makes their product different is that their thermometers not only take your temperature, they connect to an app on your smartphone. And when you take your temperature with that thermometer and you load it into the app, you connect to the app, that reading is saved for you so you can track your temperature over time on the app, but it's also uploaded and sent off to the company. You consent to do that when you use this thermometer. The company, in turn, tracks that data, and they map that data. And that has made the company uncannily good in the past at predicting upticks in the flu around the country. Quote, for the last few years, Kinsa's interactive maps have accurately predicted the spread of flu around the United States about 2 weeks before the Centers for Disease Control's own surveillance tool. So the CDC maps flu outbreaks as they happen every year. This app that tells you where people in the country have fevers turns out to be even better at it than the CDC. The smart thermometer appears to be useful for spotting fevers, and in this case, it may be very useful for spotting more than just the ordinary flu. There's brand new reporting on this just out tonight from Donald McNeil at the New York Times, and it's fascinating. According to McNeil's reporting, Kinsa Health is already, quote, tracking the coronavirus in real time, something that had been impossible given the lack of testing for the disease. Literally, the interactive maps from this company, from these thermometers that they have sold all over the country, are providing data about where coronavirus case clusters may be emerging. This reporting tonight is a big deal, and this technology could make a difference in identifying new epicenters of the coronavirus as they start to pop up all around the country. This story broke tonight. We had Donald McNeil booked to talk on the show tonight. While I got that news, I was looking at my own one of these thermometers because I own one. I've been using it about, to be honest, like 5 times a day to take my temperature. As I have been trying out various work environments and dispersing our staff around the country to try to get this show produced in as resilient a way as possible. We're back now with the reporter who broke this story tonight, Mr. McNeil, science and health reporter at the New York Times. Donald, thank you very much for sticking with us. First, let me just ask you if I hit the high points there and accurately summarized what's so enticing or potentially really useful about this technology.
Oh, God, yes, you explained it incredibly well for somebody who's never seen it before. And I think the company owes me a giant finder's fee. So I'm kidding. But yeah, I've been watching this company for about 2.5 years now, since the guy who started it, Inder Singh, came to visit me in the Times. And he showed me this notion of, hey, I have these thermometers scattered all over the country. People buy them in stores, but they also hand them out to school children in health education programs. And they now have more than 1 million thermometers with more than 2 million data points. And they can produce maps of where fevers are popping up all over the country that same morning as people get up and take their temperature and their kids' temperatures. And they know what's flu by the algorithm that says, if it's a high temperature for 3 days in a row, we assume that's flu rather than a regular cold. So now they've taken this data and, working with a professor at Oregon State, they've mapped basically the complete history, the typical range of flu in every zip code in the country for years past. They know the high and the low of the range. And so they know, once the season starts and they're tracking it, where you might expect flu to be in Brooklyn at this point now, mid-March, as the flu season is winding up. And literally, in my neighborhood in Brooklyn, they showed me, look, there are many, many more fevers being reported from Brooklyn than we would have predicted with our flu model. And we don't know what those fevers are, but the obvious explanation is those might be the coronavirus. And sure enough, just last week, they were seeing a big spike of extra fevers, if you want to call it. They basically subtract the flu data out, and what's left looks like the coronavirus data. They saw that in Florida, Florida, South Florida, was not reporting a lot of COVID cases. Now it is. Now it's an epicenter. They predicted it several days in advance. So what's great about that is you know where to bring your testing kits. You know where to bring your personnel. You know where to look for the virus if you can use this tool, instead of just blindly testing people in every Walmart parking lot in the country because the worried well are coming in a panic and causing traffic jams.
Obviously, for all of these things, more data is always better. But with the kind of sample size that they've got, in your reporting, you say that there's about 1 million of these thermometers in use around the country. Does that give you an accurate sample size for national surveillance? I mean, I guess it gives you a place to start if there isn't any other form of widespread testing or monitoring going on that could direct public health testing methods by any other means.
Well, 1 million data points is a lot more than the CDC has in its, getting weekly reports from doctors' offices and emergency rooms and things like that. These things now have started selling at the rate of 10,000 a day. So they're running into production problems, but they're getting a whole heck of a lot more data as a result of it. And, it means their algorithm is just going to get better at predicting this stuff. And unfortunately, the CDC has basically ignored them for 3 years when they've come to them and say, hey, we think we've got something. Because, typically the CDC grabs your intellectual property. If you bring something and the CDC wants to cooperate with you, they want the rights to the data so that they can publish it in the MMWR. And this is a mistake. I talked to an expert today who says, why is a private company running a foot race against the CDC, and possibly beating it when they ought to be cooperating? And we could use this to predict. They were very excited. The expert I talked to said, this is 21st century, data gathering, and we're stuck with the mid-20th century, very labor-intensive system where, a nurse in every doctor's office in the country writes down a report and sends it off to the CDC at the end of the week. This is real time. Like the minute you take your child's temperature, they have the data.
Fascinating. Donald McNeil, a reporter for the New York Times. I really appreciate you taking the time to talk to us tonight. I know you're in the middle of all of your own work. This is a real public service for you to talk to us about these emerging stories. Thank you.